Dr. Williams, I'd like to talk to you about missing teeth. See, lots of people have missing teeth sometimes for a long time, and usually they have them in the back, because when we have a missing tooth in the front, we run to a dentist rather fast. It looks awful ugly. But in the back, not so much. So you dentists keep telling us we got to replace those missing teeth fast, otherwise all hell breaks loose. And yet we patients quite often don't really notice any significant difference. So there's 2-3 missing for years. Nothing really is happening. Can you shed some light on of where this difference, where this contradiction, so to say, comes in?
Well, good question, Helmut. Whenever you're missing one or more teeth, there's going to be a snowball effect, is what I tell my patients. If you have a tendency to put it off and don't take care of it right away, you're going to get shifting or drifting of teeth, okay, which is going to decrease the amount of space to replace that tooth over time. Also, you'll get TMJ problems, which is temporomandibular joint problems, inner ear problems, and when a person goes to eat.
Let's the TMJ, and especially that other word which I cannot pronounce, which is the full word of it. You're talking about the hinges here, right? You're talking about the
right at the ear area.
Where
so
basically
when you open and close your mouth, when you open and close, you'll hear some clicking or popping. Okay, that's because you have a discrepancy in the bite. Your bite has changed due to missing teeth. Also, when you miss teeth, it causes periodontal problems or leads to periodontal problems because the teeth have shifted out of alignment, now become plaque traps, make it difficult to clean the teeth. And in doing so, it causes gum infection, bleeding. Okay, it causes periodontal pockets, which in turn is going to cause periodontal disease and bone loss. Now we got plenty of problems.
And we have talked in other videos how devastating the periodontal disease is, so we don't need to re-explain that. But
yes.
I mean, who wants to have premature babies and kidney failures and stuff? But as I said, we explained that somewhere else. Okay, so those things are happening over time, not immediately though, right?
Yeah, that is correct. It'll happen over months to years. But either way, it should be taken care of. It's similar to, I compare it to a patient that's had a hip problem and one hip is longer than the other. Okay, you can walk, but the walking is not the same. So when you have drifting or shifting of teeth due to missing teeth, you're going to be compensating in one area, trying to chew, trying to function, trying to speak as well because of the missing tooth or teeth. So it should be taken care of to get you back to a state of function.
Right. So as you compare it to a, let's say, did you say a longer leg or something? A hip?
Yes, that's correct.
Obviously, as we know, even let's say a bunion on the foot can make a person wanting to work crooked, then his knees go out of alignment, and eventually his hip and his back, and he has all kinds of back pain. So what you're saying is, obviously for some reason, whoever built us, let's just call the person a god, because it's probably what it is.
Yes.
Put lots of important stuff into that little tiny head here, right?
That's exactly right.
And, there's the brain, the ears. I mean, it's just lots of important stuff there, the eyes, right? So this is important too. And if this is out of alignment and you compare it to the hip thing, wouldn't that mean that a person gets tension in the shoulders, maybe in the back and in the head, from that out of alignment?
That is correct, because once the teeth are out of alignment, as I said earlier, it'll cause what's called TMJ joint problems, and that'll cause tension headaches up in this area here, and patients are constantly complaining about those tension headaches. Also, they'll have tightness of the jaws because they're trying to compensate chewing for the missing teeth. So it is a snowball effect. Most patients try to minimize the problem, but they shouldn't. You should take care of the problem right away.
So it looks to me that even though most dentists say that if you have missing teeth, you probably don't chew so good, and chewing not good is obviously a problem in the stomach. And while that is probably a big problem, but then you have guys like me, when my wife has 2 bites done of her steak, I'm done with it. So teeth or not, I'll just simply seem to be swallowing stuff. The point is that's probably not good. But so while, not chewing your food all that well, from what you explained, that seems to be almost a minor problem, because running around with headaches and waking up with shoulder and neck tension, there's a lifestyle problem. If you run around throughout the day having headaches and shoulder pain and neck pain, and when you drive with the car and you kind of can't turn, that's when you cannot concentrate on your job and cannot concentrate on your love life and just on everything. So,
correct.
Would it be wise for you to say that, let's just say a person who has those problems, headache, shoulder pain, neck pain, and he has tried a chiropractor or two, maybe, he has tried a massage therapist, and he didn't get quite rid of it yet. Would you say that it would be wise for him to check out from a dentist whether his mouth is aligned?
Exactly.
Whether he has missing teeth or not, because I'm sure there are other ways to make your mouth misaligned also, like a small fender bender or whatever it is, or just teeth growing crooked from the beginning. I mean, you're right.
Yeah, that's correct, because the body is all interrelated. So if there's a problem in one area, it's going to affect another area of the body. So if a person, as you said, is having the tension headaches, the TMJ problems, they should be seen. We're more than happy to see those patients to diagnose and get them on a course of health again. And when, as you said earlier, missing teeth, you're not chewing the food correctly, you're swallowing it in bolus. That causes digestive problems, leads to cancer, colon cancer, because you're not digesting the food. So it puts a stress on the overall digestive system. So it is a cascading effect. As you said, I agree with you. God made us wonderfully and uniquely. And when that particular body part is out of alignment, missing, or not functioning correctly, it's going to cause a problem in another part of the body.
Well, the reason I can think with it relatively well is, my first profession was mechanical machinery engineering, and I know when you have one cogwheel out of alignment, or broken or crooked in it, a havoc happens within a relatively short while. First it might start rattling, and that's a good thing, but it just eventually comes to a grinding halt.
Yes.
And precision is gone. So the synergy is something I'm definitely well familiar with. Well, I think you explained it well. I appreciate your candidness. And it's the everyday lifestyle which gets affected, because obviously there's no beauty, no aesthetic in many cases. You don't see it. Nobody looks into it that close. The chewing, very important, but again, people probably overlook it. But then there is that, hey, maybe your headaches, maybe your tensions, so let's go to a dentist, check it out. Because if it's not, at least you eliminate. You say, look, your bite is correct, your headache comes from something different.
That is correct.
You eliminate it or fix it. And it can be fixed if it is out of alignment, right?
That is correct. The process can be fixed, but the key is being seen and getting it diagnosed correctly, and then following through with treatment.
Thank you very much, Dr. William.
Thank you.